Hello all. Today we are going to discuss a topic about Micturating Cystourethrogram, which is also known as MCU. It is also otherwise known as voiding cystogram, which demonstrate the lower urinary tract. With this procedure is done in the X-ray department, or else in the CT department, or else with the help of fluoroscopic guidance. Okay, this procedure helps in detecting the existence of any vesicoureteral reflux or any bladder pathology or any congenital or acquired anomalies of bladder outflow tract. So, what are the indications to be followed in doing this procedure is urinary tract infection, especially in children. So, after some weeks of any acute stage of UTI, the patient will be having any antibiotic coverage, and MCU is indicated for occurrence of for the first occurrence of UTI in boys and girls. And next is voiding difficulties. If the patient feels any difficulty while passing the urine. Next is vesicoureteral reflux. Vesicoureteral reflux is nothing but the amount of urine will get reflected again into the kidney. Next is congenital anomalies and pelvic trauma. In adults, what are the indications found out is trauma to urethra, urethral strictures, a suspected urethral diverticula. So, contraindications is nothing but active clinical urinary tract infection. If the patient is having any urinary tract infection at present, this procedure should not be done. And pregnancy, if the patient is pregnant, this procedure is not done. And allergy to iodine sensitivity or contrast medium, this procedure will not be done. Okay, patient preparation is nothing but for children and for adult it differs in the preparation of the patients. For adult, no pediatric patient preparation is needed. So always the pediatric patient should be well hydrated. The patient should not be dehydrated. That is, we have to be very conscious in that. If the patient is dehydrated, it will be very hazardous to do to carry forward the procedure. So the patient must be well hydrated. And the next one is for adults, we have to ask for any history of diabetes mellitus or any renal disease or allergic to several drugs. Then fasting must be employed, and the patient should not be dehydrated. If the patient is in fasting also, the patient can take fluid items like water or tender coconut juice, like that all. Next dose is contrast media. It differs it varies from different contrast agents. Like in urographin 60%, volume is 1:3%. In contrary to 80, volume is 1:3, and in Trivideo 400 mg, volume is 1:3 ratio. They will be giving, and the procedure is done under a sterile technique. So the catheter is introduced into the bladder by a feeding tube. The feeding tube size is 5F feeding tube with the side holes, which is used for the children, and for in older children it is 8F or 10F polythene tubes are used, and in adults it is more than 10F. Okay, in girls, the initial inspection of the perineum will be identified to see any genital abnormalities are there whether before inserting the urethral catheter. When the catheter enters the bladder, bladder, a varying amount of urine will flow through the catheter. Okay, after that, if there is no flow, the catheter is advanced until the urine is obtained. When the flow is not yet obtained, the catheter will be inside the urinary bladder until the amount of fluid urine gets out. Okay, after that, the suprapubic pressure is sometimes given to pass out the urine through the bladder via the tube. Okay, if no urine is obtained, the catheter may have been inserted into the vagina for a few times. Okay, after that, in males, what they will do in a sense, they will retract the foreskin and the catheter is then introduced. Okay, the catheter, before introducing the catheter should be well lubricated with anesthetic jelly, and it is gently inserted into the urethra of the male patient, holding the penis in a vertical position. Okay, the normal once after inserting the catheter, the radiologist will insert the contrast media through the catheter. After the bladder capacity is filled, what they will do in a sense, when the patient feels uncomfortable, and certainly what they'll do in a sense, they'll start to void around the catheter. So at that time what they'll do in a sense, they'll take the filming. So in children, how they'll take the filming in a sense, for children up to the age of 2 years, when the bladder is filled by hand injection, through the hand injection, the bladder will get filled. Okay, so for older children, until the contrast medium is filled, what they'll do in a sense, they'll examine the patient. After filling, the child is turned in the oblique position, either in the left oblique and in the right oblique, and the both sides of the oblique position, the patient is turned to see whether the reflex has been overlooked or not. Okay, after the reflex appears, films are taken in several oblique projection, and after that the patient is asked to void, and the patient will be left out of the examination room. In adult male, what they will do in a sense, once the bladder is filled in an unusual way, the voiding film will be taken. Okay, a voiding film will be taken in both the oblique projection. So in adult female, what they will do in a sense, same as like girls, the procedure is done for the adult female also. So once the bladder gets filled and the reflex starts and the urine starts to get reflected, the filming is taken in a standard exposure types, and by straining the bladder, the filming will be taken at several degrees to descend if any abnormalities are there or not. So after doing this procedure, what are the complications the patient will feel in a sense? The patient may be attend any type of dangerous infections due to the catheterization into the bladder. Next, adverse reactions may appear due to the contrast medium, and due to the technique, patient may have any acute urinary tract infection and catheter trauma causing like dysuria or pyuria or hematuria, several infections, urinary infections may be occur, and retention to Foley's catheter may happen, and then autonomic dysreflexia will be complicated to the patient. So what are the aftercare we have to give to the patient is nothing but we have to ask the patient to be well hydrated for 24 hours. After that, we have to insist the patient that the feces or the urine while they are voiding will be in a whitish color for 2 to 3 days. So that is the aftercare. We have to insist for the patient, and we have to send the patient to the back to their room.